Hello, my name's Mark Shenton and I'm a GP, a doctor that works in a family practice local to you maybe. And I'm going to talk to you about why it's really important that you have a health check with your local doctor. And there's really just two main things that I would suggest why it's important to have the health check. And the first is to just help you keep well. Keep well now and help you keep well in the future. And doing the health check is purely aimed at doing that. However, if you do have a condition that needs some monitoring, or if you're taking some medication, it's a great opportunity to have that looked at and make sure that it's working best for you, and that's what your doctor will help you with. So if you can come and have a health check with one of us, it'll do you the world of good. So to help us remember what to do for you when you come in, we use a computer, and on my computer here we have a special little, what we call a template, which tells us all the things that would be good to know about you and that we can keep as a record, so that in the years to come we can see how you've been doing. And so when we use the computer, we might need to turn away and put the information in, but we're not ignoring you. We're just making sure that we're capturing the right information about you and keeping it in the right place. So when people come to the doctors, they sometimes worry about what kind of things might the doctor do to them whilst they're sitting having their consultation with us. And when you come for your health check, there will be some checks that we do that needs us to take some measurements from you, be it getting you onto the weighing scales, or, as I'm going to do with Daisy now, check her blood pressure. And that's one that a lot of people worry about because it's a cuff around your arm, and that cuff gets a bit tight as I pump it up to be able to see what kind of pressure your blood is going through your arteries with. So it's a bit of a squeeze, it doesn't hurt much, and it goes down quite quickly, and I'll just show you how we do it. It's a noisy old Velcro. Wrap it around your arm, and then I use my very old-fashioned stethoscope to listen in to the blood as it's going through Daisy's arm. And then I use this pump here to pump air into the cuff that gives a bit of a squeeze. Can you feel that, Daisy? Yeah. And then I gently let the air out of the cuff, which takes the squeeze off, and then I can hear Daisy's blood coming back into the artery, and her blood pressure is perfect. And that's it. And the other bit of equipment we often use is this thing called an otoscope, which looks into people's ears. And we do that to make sure that if you have any hearing difficulty, we might be able to find out what the problem is. And I'll just show how we use it. And it's quite simple. And sometimes, interestingly, when we put the otoscope speculum into someone's ear, it can make them cough. But not to worry, it's just one of those things that happens. Not very often, but it does sometimes happen. So if you can look that way for me, Daisy, and I'll switch the light on. And I'll see if I can see the wall through the other side. And then I'll come round to look in the other one. Clear as a bell. And that's it. So when we ask you to come for your health check, we'll often ask you to bring a wee sample with you, which sounds a bit strange. But a wee sample helps us to find out whether you might have a condition called sugar diabetes, or sometimes we can find out troubles that may be affecting your kidneys. And it's a very straightforward test. You just put a wee into one of these little bottles, and then I test it with a little strip that I've got here, and I can show you how we do that. It's very straightforward. So what I do is just take one of these strips, dip it into your wee, put the lid back on, and then within half a minute we can check to see what's going on. And it's as simple as that. And then we'll ask you to take your wee home so I don't chuck it down my sink.